Thank you, Tracy, and thank you, Mayor Morrow. So we're in this together, and certainly one thing I want to assure the public right now, though, is Thunder Bay Regional Hospital is open for business. We're being overwhelmed by COVID-19, and the public's being overwhelmed by COVID-19, but medical disease continues to occur in this city. We are still open for all aspects of essential care. That includes priority surgeries for cancer, include priority surgeries for heart and lung. So we're open for business. So I want to urge the public, if you have a medical problem, you come to Thunder Regional Hospital, or you phone your family doctor, and the family doctors are really stepping up, and they actually continue to do their walk-in clinics, continue to open business for primary care, with appropriate individuals coming. So one thing for sure, we are open for business. Healthcare in this city is open for business, despite the overwhelming concerns we have with COVID-19. But we're in this together, and what I mean by in this together, we can only stop the spread in the community if every individual takes their social responsibility. So I'm going to give you an example. If you have someone returning from Florida, you have someone returning from the United Kingdom, and they are not maintaining their 14 days of isolation, we as healthcare workers can call upon it, but we expect every public person to actually call upon it. We need to stop the spread, and we can do this if every individual really takes this very seriously and actually commits to actually maintaining the protocols outlined by public health. And also, and those are, stay at home if you can, take this COVID-19 very seriously, practice social distancing, and if you do all these measures, we can flatten the curve, and we can actually decrease the spread. And right now we have no COVID cases in Thunder Bay. We expect we will, but if we do all these right sort of practices, we can actually provide a safe community both in Thunder Bay and Northwestern Ontario. So I urge the public, first off, we're open for business, but also let's take all those precautions that's outlined.
Okay, Dr. Kennedy, is the hospital prepared if confirmed cases of COVID-19 do appear in our community?
Well, we have an amazing leadership team. We have an amazing set of healthcare workers, and we are very prepared. You can never predict some of the unexpected occurrences, but we are very prepared at this point in time. We've been implementing our pandemic plan for the past several months. We continue to learn on a daily basis. We continue to update on the medical directives on a daily basis. We've learned in the past from past pandemics, which is the SARS, which is H1N1, which is the Ebola crisis. We are well prepared for all of that. We put significant measures in place to protect our staff and also protect the patients here in this facility. But again, the better we protect our staff and healthcare workers depends on the public following those protocols.
Okay. Why is the hospital reducing surgeries and services if there are no confirmed cases yet?
You know, Tracy, you can never be over-prepared for a situation like this. And I'll give you an example. Right now in our hospital, we have total funded beds 389. As this morning, we had only 300, and that means 77% occupancy. By canceling surgery, elective surgery, that does not threaten the lives and the well-being of our patients here in Thunder Bay, we hope to get that bed count down to 250. Get that bed count down to 250, and this virus hits Thunder Bay, we have excess capacity to take care of those individuals who need our services. So we need to take this measure, not only because we're directed to by the Ministry of Health, directed to by the OMA, directed to by Public Health. It's the right thing to do, and we've been advancing this for the past several weeks, and the team has put measures in place so the public, the patients, are not harmed for the measure we're putting in place right now.
Okay, so people are not put at risk by this reduction. Do people who need urgent care still get it?
Absolutely. As I said in my opening comments, people at the hospital are still open for business, and certainly there's going to be some inconvenience. There's going to be some individuals that really feel their surgery has a higher priority than somebody else's surgery, but we're having the professionals, the physicians, the nurses, sort of determine what is the priority service, what is the priority program that we keep open, and this team is meeting again twice a day. We have a team of probably, I'd say, over 100 making all these decisions together and functioning into our incident management team.
Can you tell us, is the hospital safe for patients, doctors, nurses, staff?
Since the weekend when we put these screening measures in place, since we enhanced housekeeping and sterilization, the hospital has always been a very safe, clean environment. But what practices we put in place over the past several weeks has really enhanced that. So now, as you know, we took the very difficult step to limit visitors, to almost exclude visitors except for caregivers. As this initiative expands and COVID virus gets to Thunder Bay, we may have to take more aggressive steps with our care providers and totally limit visitors altogether. But that's a step we will not take lightly, and we'll take that with the advice of our medical specialties, and we'll take the advice of infectious disease and public health. But certainly, if you notice when you come into the hospital, because we're off-site right now, but you've had your screen, you have hand washing. You certainly, if you fit the protocol, you get in. If you don't, you get out. So it's really, really, really significant that we keep these high-level hygiene, high-level cleaning in place. One thing I didn't mention too, Tracy, is because I always get a question about our assessment center. So individuals who think they may have COVID virus and meet the protocols, they will not come into the hospital if they're not that symptomatic. They will actually go to the assessment center, and they will be screened by health professionals, and at that time they'll determine whether they need a swab or not. You get a lot of questions about the swabs right now, the public. We have enough swabs in this city, in this region, to do, as long as we follow the medical directives, to take care of the public. Everybody who meets the screening criteria will get swabbed. In fact, we're putting things in place now to actually enhance our ability to, potentially over the next 3 or 4 weeks, to do in-house swabs. So no longer will it take 4 to 6 days to get it back. We hope in the next 3 or 4 weeks we'll be able to do our in-house swabs that will meet quality control, meet standardization, and get even quicker turnaround as the virus escalates. And just for your information, we've been in operation for 3 days. Patients seen at the assessment center is 91. The amount of swabs is 85. That's because they're supposed to phone the public health department or telehealth first. They're screened there and they sent to the assessment center with appointments. So the protocols are working at this point in time. They may change from day to day because this is increasing on an hourly basis, but that's the process now. We'll revisit that if the more people in this community need swabs. But I want to reemphasize, everyone who needs a swab, who meets the protocol, will get swabbed.
Thank you very much for that clarification, Dr. Kennedy.
Thank you, Tracy.